Hello, and welcome to our first in a series of 6 lectures over the reproductive system. This is the last chapter that we will cover this semester. So if you have questions, please email them to me. I'll be happy to answer them to the best of my ability. This is usually one of the more entertaining lecture series when I'm able to be with you in person because of the expressions on your faces and some of the really funny things that get said and asked. It's very interesting. So when we look at the reproductive system, remember that it doesn't become active until we go through puberty, and for girls, that's usually around the age of 12 to 13, and for boys, usually around the age 13, 14. The reproductive organs have the same 4 tasks. They form the gametes. So in males, this is the sperm, and in the females, the eggs. Through copulation, sexual intercourse between a male and a female, then the gametes come together and they combine to form a zygote. So a zygote is the first stage of fertilization. And if you want to read more about embryology, I suggest you read the next chapter in your lab book. It does a good job of explaining things. And if you ever have the opportunity to take human embryology, that would be fantastic. It's fascinating. You do need a background in genetics before you take it. And then the fourth thing is there is development of the fetus and birth of the baby. Now, the first 8 weeks of life are considered the embryonic period. And so that's months 1 and 2. Remember, it's 40 weeks. And so the next 32 weeks are going to be development. And that stage is called the fetus. The fetus. All right? So those are the 4 things that they have in common. So what are some of the common features between males and females? And yeah, I'm not talking about anything that is surgically done. I'm talking about what's called homology. So homologous structures have the same origin during development. And so this is going to be the gonads, the penis, and the clitoris. So the gonads, which are the testes in males and the ovaries in females, just in case you didn't know, are going to produce the gametes, sperm from the male, and the ova from the female. And of course, this is through the process of meiosis. You may have heard it pronounced meiosis. And remember that gametes are haploid. If you need to review mitosis and meiosis, your textbook has a really good review and your lab book has a good review. The other thing that the gonads do is that they produce the steroid sex hormones, testosterone, estrogen, and progesterone. And in truth, males and females have all 3 of these steroid hormones. It's just that in males, you have a large amount of testosterone and a small amount of estrogen and progesterones. While in females, we have large amounts of estrogen and progesterone and small amounts of testosterone. But ladies, after we go through menopause and our estrogen and progesterone levels are going to decrease, and testosterone really doesn't increase. It's just that estrogens and progesterones decrease. And so we will start having male-like characteristics depending on the balance. You might start having coarse hairs in your chin. you get the lovely little mustache. And some women, their voices will deepen, and so it's really a balance of the hormones, not presence or absence. Okay. What are our accessory organs? Well, ducts, glands, and the external genitalia. So all of this is going to be regulated by what's called the hypothalamic pituitary gonadal axis, HPG. And you need to know this. So we're looking at what's being released by the hypothalamus that affects the anterior pituitary and then the testes or the ovaries. So this is going to go through looking at testes. So we're looking at, in the male, the interaction of gonadal releasing hormone, follicle stimulating hormone, luteinizing hormone, testosterone, and inhibin. If you need to, go back and review these from chapter 16. So gonadotropin releasing hormone is released by the hypothalamus. It works on the anterior pituitary cells to cause the anterior pituitary cells to release follicle stimulating hormone and luteinizing hormone. These hormones are going to affect for the males in the testes the production of testosterone. Okay? In the female, it's going to cause the production of estrogen and progesterone. Inhibin is an endocrine that's released from the ovaries and the testes, and basically it inhibits the release of follicle stimulating hormone from the anterior pituitary. So here's a nice little picture. So this is going to activate at puberty. And up until about 40 years ago, a lot of girls did not start puberty until about age 14. And now we're seeing puberty starting in girls as early as 8 years old. And part of the problem may be chemicals in our environment that are endocrine disruptors. Another problem could be, for many, many decades, cattle were shot up with hormones to make them grow faster, produce more milk, and those hormones came out in the milk, and then we drank it, and we see some of that causing problems. In males, we're seeing puberty starting 13, 14. It's always been about that. But what we are seeing in males is that they're producing fewer sperm. And once again, this may be due to overcrowding. It may be due to the endocrine disruptors in our environment. Talk to Dr. Ledeen. He's got some interesting views on this. So as puberty approaches, the hypothalamus becomes less sensitive to inhibition by the steroid 6 hormones being produced by the adrenal gland. And what happens is, as they become less sensitive, then the hypothalamus will release the gonadotropin releasing hormone, and that will cause reproductive organs to grow. And as they grow, then they're going to release hormones. So the anterior pituitary will release follicle stimulating hormone and luteinizing hormone. FSH and LH are going to stimulate the gonads to release testosterone, estrogen, and progesterone. And this will continue until this adult pattern gets established. And in some people, it establishes really quick, and in other people, it takes a while. Depending on diet and health, it may be that some teenage boys who haven't gone through puberty by the time they're 15 will need an injection to stimulate the onset of puberty. Same thing can happen for teenage girls. So we want to get this to be an established pattern. So what are we thinking about here? As this adult pattern establishes, then we're going to see meiosis take place. Like I said before, if you need to review this, go back to your book, read through it. It's pretty nice. Go ahead and make sure that you understand what's going on. Go to Crash Course and view their videos on meiosis. I don't have time to explain, but the result of meiosis in males is 4 haploid, genetically different sperm. In females, the result of meiosis is 1 haploid ova with 3 haploid polar bodies. And so here you have an overall view of meiosis 1 and meiosis 2. And you notice that after meiosis 1 is completed, the cells are haploid. Here's another table going over the details of meiosis 1. Make sure you look through it to review what you understand. And then meiosis 2, go ahead, review this. Ask me questions when you have time. Mitosis and meiosis, remember that they're 2 different things. The end products of mitosis are 2 genetically identical diploid cells, where the results of meiosis are 4 genetically different haploid cells. All right, here's a good place to stop and stretch. And then we'll talk about the anatomy of the male reproductive system. So when you think about the anatomy of the male reproductive system, probably the first thing that comes to most people's mind is the penis. And then you have the scrotal sac, which contains the testes. And remember, since in the testes produce the sperm. So you need to know how sperm gets delivered from the testes to the urethral opening. So they're going to travel through the epididymis to the ductus deferens, which is also known as the vas deferens, to the ejaculatory duct into the urethra, and then out of the urethra, either into the vagina of the female or, let's just say outside the body. There are accessory glands that are very important to the survival of the sperm. These are the seminal glands, the prostate, and the bulbal urethral gland. The bulbal urethral gland used to be called the Cowper's gland, but remember, we're getting away from naming things after people. And so here you have a picture of the male reproductive tract. Pay attention to where is the bladder. Find the bladder. Okay. Find the rectum. Find the bladder. All right. In between, then you're going to see the ampule of the ductus deferens, the seminal vesicle. Remember that the prostate surrounds the urethra, and then the bulbal urethral gland is going to join the urethra at the root of the penis. So get your bearings and look at this picture and figure out what we're talking about. The scrotum and the testes. You gotta your R's when you say scrotum. So this is the sac of skin. It's outside the abdominal cavity. It's at the root of the penis. It's where the testes live. And remember, the testes need to be cooler than normal body temperature so that sperm production takes place. All right. The scrotum has two compartments, one for each testis. Testis is the singular for testes. You have one testis in each compartment, two compartments, therefore two testes. So there are two muscles that you need to be aware of, the dartos and the cremaster. The dartos is going to be the muscle that wrinkles the skin. So when guys get cold, their testes, their scrotal sac will wrinkle up and the cremaster muscles will elevate or pull the testes up closer to the body cavity to keep them warm. Now, I'm sure the guys understand exactly what I'm talking about. But notice that the cremaster muscle is a skeletal muscle. So it's under a little bit of control, but not much. Look to see where the testicular artery and testicular veins are located. Find the spermatic cord. All right. So each testes has two tunics, the vaginalis and the albugenia. And the one you're here talked about the most is the albugenia. These are going to form septa, which will divide each testes into 250 lobules, and each lobule will contain up to 4 seminiferous tubules, and it's in the seminiferous tubules where sperm are being produced. So the sperm is conveyed from the seminiferous tubule to the straight tubule, the wreathed testes, the efferent ductules, to the epididymis. All right? To the epididymis. Now the sperm are going to be stored in the tail of the epididymis until ejaculation, and this allows the sperm to mature. To see, the spermatic cord encloses nerve fibers, blood vessels, lymphatics that supply the testes. All right. And so here we have our lovely picture. Find the testes or testis. Find the seminiferous tubules. This is where sperm are made. Find the tail of the epididymis. This is where sperm are stored until ejaculation. And then they will flow through the epididymis to the ductus deferens. Okay, up the spermatic cord. Up the spermatic cord. So here you have a cadaver view. As far as testicular diseases, there are very few, but testicular cancer is very common. Type of cancer, let me say that differently. Testicular cancer is rare, but we find it more in males 15 to 35. And so guys, this is why it's so painless. It's so important for you to examine your testes for lumps and bumps. Once a month in the shower, soap up, feel around, make sure you don't have any lumps or bumps. I would also encourage you to do a breast exam, just to make sure that you don't have any lumps or bumps in your breasts. Good grief. So I know you're looking at me like, I'm going to do that. Okay, but guys do get breast cancer more often than they get testicular cancer. But usually what happens is that they take out the one testis that is affected, because usually it's just one, not both. And so that gets rid of the problem. They'll check the lymph nodes to see if the cancer has spread. I do know that there are prostheses that you can have implanted into your scrotal sac so that you feel more balanced. Some guys find this incredibly important and some don't. Epididymis, ductus deferens, ejaculatory duct, and urethra. All right. The sperm are going to mature in the epididymis. All right. And what blows my mind is that the body and the tail of the epididymis are about 20 feet in length. Think about that. In that little testes, 20 feet. That's a lot of surface area. And that's a lot of meiosis taking place. Okay. So, when we look at this, the sperm are going to pass through the epididymis over a period of 20 days. And during that 20-day period, they finally figure out how to swim. But they can be stored for several months. As the sperm are during ejaculation, then the sperm are going to move into the ductus deferens. And it's going to expand to form an ampulla where it's going to join the seminal vesicle to form the ejaculatory duct. And this is all under the power of smooth muscles. And if you've ever wondered about what do they cut for a vasectomy, they cut and ligate the ductus deferens. And this can be done in the doctor's office with local anesthetic. It is nearly 100% effective. Sometimes if the ligation is not done properly, then the tube will find a way to grow back together. And there are all kinds of stories online about tubes growing back together and causing all kinds of problems in the family. So look at this picture again. So the sperm are going to start in the seminiferous tubules, go into the epididymis, mature in the epididymis, then during ejaculation come out of the epididymis into the ductus deferens. After they come out of the ductus deferens, they enter into the urethra. Remember, in males, the urethra has the prostatic urethra that's surrounded by the prostate. Notice that there's not an R. It's not prostrate. Prostrate means to fall flat on your face. Prostate is an organ, and we hope that your prostate is never prostrate, because that would be very, very painful. Then we have the membranous urethra, and then the spongy urethra. And it's the spongy urethra that runs through the penis. And so let's take a look at this. Look at where is the ductus deferens. Find the seminal gland, and you see they join together and dump into the urethra. That's called the ejaculatory duct. Then down beneath where it says ejaculatory duct, you see the bulbourethral gland and its duct, and it dumps into the urethra. Okay? And then the sperm will travel down the penis and then out the urethral orifice. And notice in this crosscut of the penis, you see the corpus cavernosa. SA means plural, so there are two of them. Corpa. Some people will spell it corpa, some people will spell it corpus. But there are two, cavernosas. They are cavernous. They have little caves in them that fill with blood during arousal. And then you have the corpus spongiosum. The corpus spongiosum. And what do you notice in the corpus spongiosum is that's where the urethra is found. So the urethra is traveling through the corpus spongiosum. The urethra is surrounded by the corpus spongiosum.